Hello, and thank you for joining us for our webinar, Return on Experience, Why Investing in Experience Matters and How to Measure It. I'm Adam Rubenfire, a content manager at Phreesia, and I'll be moderating today's presentation. Today, our speakers will discuss how experience influences the success of healthcare organizations and why leaders need to make it a priority. Our speakers will offer an agenda for the webinar in just a moment, but I'll take just a brief moment to share some housekeeping notes and introduce them before they get started. You can submit questions at any time using the Q&A widget at the top left-hand corner of your screen, and I'll ask as many questions as we have time for. In the resource widget on the left-hand side of your screen, you'll find a one-page overview of Phreesia and our product offerings, a white paper about healthcare consumerism, featuring insights from a survey of more than 4,000 patients, and a blog post about how to make patient experience your differentiator. If you have any technical difficulties, please click on the help widget. It has a question mark icon and it covers common issues. And since it's always one of the most frequently asked questions, this session is being recorded and we'll share a copy of the recorded presentation by the end of the week. Finally, a few quick words about Phreesia. Phreesia is the nation's leader in patient intake, and we're guided by our overarching mission of creating a better, more engaging experience for patients, providers, and staff. Our innovative platform enables our clients to improve efficiency, enhance clinical care, and gives patients the convenient, flexible experience they prefer. We're proud to have been top ranked in patient intake management by KLAS for 4 years in a row. If you're interested in learning more about Phreesia, you can request a consultation using the drop-down on the right-hand side of your screen or visit phreesia.com. But enough of that. I'm thrilled to hand off the presentation to our panelists to introduce themselves and start their presentation. Strategy and team, I'll hand it off to you.
Hi, everyone. I'm Matt Egol. I'm a partner in our customer transformation practice. I work across industries helping clients design and build capabilities for customer and employee experience, and I help to co-create return on experience that we're going to share more about today.
And I'm Patrick Maher, a partner with Strategy and I focus on helping our health system clients chart out a course for their long-term strategy, but I think most importantly, how they can create a better and more consumer-focused experience and ultimately gain better health and well-being for the consumers that they serve.
Thanks, Patrick, and thanks, Adam, for having us. I'm Inshita. I'm a director with PwC's Strategy and Customer Transformation practice. My work focuses on strategy for large health system clients, especially around delivering consumer experience strategies, workforce strategy, culture, as well as org effectiveness transformations. Just to quickly go over the agenda that we have today, we'll start by talking a little bit about why experience matters. Then we'll go into what is return on experience and how we actually go about the task of measuring it. And then end with how do you get started on your ROX journey, giving you some hopefully tactical items that you can start doing the next day. So with that, let's dive into why experience matters. You'll see a lot of stats on the page, and I think intuitively, we all know, right, that consumer experience matters. But in this digital interconnected world, consumers have more and more ownership and expectations of that lower cost, higher value, and convenience, especially from healthcare companies, and they've been missing it in the past. We've seen that organizations that coherently design their systems to focus on consumer needs really have higher financial as well as experience metrics. So you'll see this on the page, for example, 5 times revenue growth for CX leaders. So from a financial perspective, and these are the more visible benefits around revenue, pricing, right, and growth for CX leaders in their respective industries. But there's also benefits from increased customer spending, their share of wallet, more loyalty, and more retention. You'll also see on this page that we talk about EX or employee experience, and we really see them as kind of two sides of the same coin. You can't really deliver on that great CX without focusing on your own employees. And companies that do well on CX and even brand metrics tend to rank higher, as we've seen in rankings such as Great Places to Work or and have better kind of employee engagement as well as productivity scores. So overall, when EX and CX are being enhanced together, you really see some of those more intangible aspects where the sum is greater than the parts come together as well, with greater operational efficiency, higher productivity, and even lowering the overall cost to serve your consumers. Talking a little bit more about that employee experience piece, as I just established, those robust employee experiences are really key to delivering a great CX. But if you see on the right-hand side of the screen, employers who are really able to provide holistic support with minimal friction enable that maximum productivity. So some of the pillars that we see for employee experience, as you see in this diamond, if you will, is a supportive organization. So really making sure that your systems, your culture are supporting that employee experience. Good people. So are you driven by that vision and purpose of the organization? Productive environment. Do your employees really have the tools, the flexibility to deliver on their work in a very productive manner? And are they enjoying the work? So again, going back to that culture element, teaming, and even how their career progression and work is set up. So really focusing in on these aspects will get you to some of these benefits around innovation, customer satisfaction, and overall greater profitability. That was probably a lot to digest, but let's talk a little bit more about making it real. So to give you an example of a healthcare system client that we've been working with recently, we worked with a large health system and helped them really differentiate in the market based on customer experience. And we leveraged some of the tools that we talked about. So we also leveraged employee experience as well as culture in helping them get to their CX goals. Patrick, would you like to talk a little bit more about this example?
Yeah, I think the main point here is how connected the consumer experience is with the employee experience. That was one of the fundamental and early lessons we learned in working with our client, that we had to bring these two perspectives together. Care teams today, we see this every day, they're overburdened, they're burnout, and they're really struggling to manage their day-to-day existence and working within their system. So we wanted to intentionally unburden our care teams to the extent that we could, so that they could redirect that energy and effort towards creating more meaningful and impactful consumer experiences for the sake of their patients. And so the organization that we worked with was very holistic in their thinking about how they drive a better patient and consumer experience. And we really detailed that out by not only designing a core consumer experience and ultimately differentiated products and services that would enhance that experience for the patients that we really wanted to serve. But in parallel to that, they brought the organization along. And that was, I think, a critical success factor for them being ultimately more impactful in their implementation of this. They went in and understood what the culture was in today's organization and what behavior changes they needed to make across the organization to enhance ultimately their consumer IQ, if you will. And in support of that, they built a consumer experience organization around that to ensure that the insights and actions that were needed to enhance the consumer experience were spread across the organization. Matt, let's talk about what return on experience is, because we've really highlighted this importance of consumer experience and employee experience. I know this is your bailiwick here. So let's talk about what return on experience is and how do we measure it.
Thanks, Patrick. I'd be happy to. ROX, or return on experience, is PwC's unique approach to experience management, or XM. And think about ROX as getting beyond NPS, or getting beyond any golden metric, because there is no single metric that you can use that'll capture all of the richness around the consumer patient experience or the employee caregiver experience. It takes a system of metrics to understand the drivers of value and how to drive continuous improvement in the experience and link it to business outcomes. So it's not that other metrics like CSAT or NPS are not important. It's just that they're not enough on their own to give you all the insights you need to drive improvement in business outcomes. And we would encourage you to think about this as an ongoing iterative process where there's an insights to action loop that you want to spin faster and more effectively so that you're able to drive insights that you can use to drive improvements in specific business outcomes. And the insights that you want to be part of that loop include a variety of data, experience data, and operational data. Experience data are not just surveys, although surveys are important. So getting the right survey-based input is important in designing the surveys, both relationship or transactional surveys, which are triggered by specific events occurring that you then issue a survey, as well as increasingly AI, artificial intelligence, and natural language and text analytics, what's often called intelligence scoring of unstructured data. So you can look at things like voice to text from call centers, live chat, chatter, messaging, or open questions in your surveys, or social sentiment, like social media. All of this unstructured data is actually a very rich set of data that goes above and beyond what you're going to learn from a survey. And in fact, in many cases, you don't need to ask a survey because the intelligent scoring can predict what the survey would have said. So those are X data. And then you combine that with operational data out of your systems, which could be how often someone calls, how long they called for, did they get their problem resolved. These are all operational data that you combine with the X data in order to drive this insights to action loop. And you're going to drive this on an ongoing process in order to drive benefits that you reinvest in a continuous cycle. And ROX is something that we are doing not only in healthcare, but across industries. It's definitely an area that we've seen a lot of attention in healthcare, but a lot of the leading practices are being brought in from other industries. I myself started my career working in customer experience, working with retail, travel, and hospitality, and then brought in to work in other industries like tech and financial services and healthcare and industrial and in utilities. So a very broad range of industries, all of which have frontline employees as part of their experience. And you can see here a range of examples building on the one Patrick shared. A couple of things I'll emphasize here. You'll see the focus on business value and business outcomes. You'll also see that the savings you achieve from improvements in call volume or in research and testing or other quality outcomes can be reinvested in building capabilities. So these are often self-funding investments because of the costs and benefits you're achieving, but those also drive quality outcomes that are really important to that consumer and employee experience, which creates this flywheel spinning of continuous improvement. So this is a very agile, iterative approach where you build capability and you continue to reinvest the benefits in improvements on an ongoing basis. On that point, let's take a dive deeper into X data and O data in the context of healthcare. You can get very specific experience and operational data that are particularly relevant to healthcare. So this builds on your HCAP scores or other quality scores you may have. Operational data may be focused around the quality of care and problem resolution and the service experience. And there'll be employee experience information that you want to capture that complements information from the consumers. All of this can be targeted at a clear set of hypotheses or areas that you want to drive value. So it's important to start by looking at the outcomes and benefits you want to drive, and then work your way back to how do you evolve your X and O data to get the insights you need to drive continuous improvement. It's a quality management process of continuous improvement leveraging these insights.
So let's take that into another case example with a different healthcare client, where we developed a holistic set of experience and operational metrics and tied that together. And it really wrapped around a core consumer experience vision. At the bottom of the page, you see the customer KPIs that we were working with. Their operational efficiency, improvement in loyalty, driving growth, and overall net promoter score. On the left-hand side of the page, you see the experience outcome metrics that we were vectoring in on, and on the right-hand side of the page, the operational metrics. And we want to bring those two together so that we're ensuring that we're constantly delivering on the experience that we want or the outcome that we're trying to achieve. And so you see at the top of the page here, the simple metrics. So customer effort. How easy was it for the consumer to really resolve within one interaction? And the net promoter score per channel. So in that channel that we're interacting with the consumer, what's the net promoter score? Operationally, what does that mean? Well, how often did we resolve the issue at first contact? How many times did we transfer the call? And did we resolve it within that channel? As we get progressively more complex here or more sophisticated, we want to start getting to more customized measures. Specifically there on the experience side, is the content relevant to the consumer? Did we really meet their needs by getting the right content to them at the right time in the right place? And how did that drive customer satisfaction of the interactions that they've had with us? Operationally, how do we measure that? We look at the next best action adherence, right? How good or how well did we satisfy the consumer, and did we give them a next best action that was actually relevant? Finally, as we get to trust down at the bottom of the pyramid here, we want to really understand from an experience side the confidence rating. How confident is the consumer in us and our ability to solve their issues, meet their needs? Ultimately, how does that manifest in improving the brand perception with our organization? And how does the net promoter score improve across all lines of business that we're serving the consumers? So that trust then extends across the organization. It's building a relationship with the consumers. Operationally, we want to measure, well, how well we're resolving the issues. What's the rate at which we do that successfully? So how do you get started on a return on experience journey? Let's talk about that, and we'll try to keep this very simple. It can get quite complex fast, but we want to keep this a very simple framework that's easy to follow. So step one, as you heard Matt talk about, we need to go beyond the traditional standard HCAP scores and net promoter scores. Those are great measures, but there are many more. So we need to extend our view here so that we're capturing better data around how our consumers are experiencing us and how satisfied they are with that experience. We want to listen at the right point of time in the consumer journey. not always are we measuring things, or should we be measuring things at the very end of the journey after it's done, or several weeks or days or months after. We want to perform the right type of listening for the moments that matter. Third, as Inshita talked about, it's very important that we bring in the employee experience. They're essential to creating the consumer experience that we want and desire. And so we really need to listen to their feedback and leverage that feedback in creating better experiences. And finally, if we want to scale this and scale it efficiently, we need to leverage the technology solutions that are out there today. There are many, and we should leverage those to help us gain insights, collect data, and take actions in a much faster way. So I'm going to talk a little bit about number one here and number two, the first two items here. And what you see on the page, it's a little dense, apologies for that, but we want to select the right consumer experience metrics that are aligned to our strategy. And we want to line up tools, measurement tools that allow us to listen to those signals in a good way. And you see across the top that we've got several layers of consumer experience metrics. We've got the consumer satisfaction on one side, brand sentiment, brand advocacy, and trust. So let's talk about consumer satisfaction for a second. In order to listen to the signals that our consumers are telling us, giving us the feedback, we can do email surveys or pop-up surveys. Those are pretty easy to deploy, but we can also and should deploy text analytics in our contact center interactions. There's a lot of conversational elements that our consumers and customers are giving us. They're giving us a lot of feedback when they interact with us. So let's run the text analytics to be sure that we're really understanding how well they're satisfied with us. For brand sentiment, best listening tools, text analytics for reviews and social media. So we should be listening to what our consumers, our patients are saying about us in the marketplace. They're influencers with their friends, their families, their colleagues. We want to understand how we're doing and if we're really satisfying their needs, and can we turn them into an advocate for us. That's the next level. Again, we can listen by survey and text analytics, as well as social media. As we get to trust on the far right-hand side of the page, we extend that a little bit more. The surveys and text analytics are very important, but there we really want to bring in tools to leverage and understand what our employees are thinking about those interactions. This needs to be a balanced equation as we create better experiences for our consumers, and that balance can't come at the cost of our employees. If we're really creating a more complex experience for our employees and they're less satisfied, then one is winning, say the consumers, but we're going to have different problems in retaining and developing the important people that serve those consumers. So we want to bring all that stuff together, and we want to listen very broadly across the consumer metrics so that we can create, well, privileged insights about the consumers that only we can develop. We can't just, issue a survey out there. This is unique to us, and we can really detail and define specific consumer experience improvements that we want to make. We can hone in on those frustration points. Sometimes they're on the employee side, sometimes they're on the consumer side. Inshita, do you want to share a little bit about listening more on the employee side?
Yeah, definitely. So as we think about employee listening and employee experience overall, we think about it in 3 stages. And just to preface that, these stages can be looked at simultaneously. So it's not like you have to go stage 1, 2, and 3, but there is that element of you can't reach stage 3 unless you've started to do some work on stage 1 and 2. So 1 is really unburdening the employees. If employees have a lot of pain points and obstacles in their daily tasks, whatever you expect out of them on a CX perspective will really be seen as a burden and they won't be engaged. So really expanding those employee listening programs beyond annual engagement surveys to tap into more regular input, including networks to gather input and test ideas, mine discussion forums or intranet forums that you might have via some of the AI and text analytics tools that Patrick just talked about, as well as really mapping that employee experience and thinking about where are the moments that matter for employees, where they're really putting in that increased efforts and experiencing burnout. The second stage is enabling employees, really equipping them with that tools and technology to facilitate engagement and connection with consumers. Healthcare employees in our experience really are motivated with the time that they're spending with patients and really taking care of patients, right? They joined this industry because they were motivated by taking good care of patients, but knowingly or unknowingly, we have put a lot of technological and admin burden on our employees. We've heard from healthcare companies that employees are carrying around like 2 or 3 devices. They're not able to communicate with patients. They're spending a lot of time doing admin work and charting, and all of that does take away from the employee experience. So it's really using tools such as automated form fills, predictive scheduling for employees, enabling that two-way patient communication and giving them time for it, really will help increase that engagement from employees and deliver on that CX. And stage 3 is really when you empower your employees to own that consumer experience. It's really a very powerful loop that you can activate. So employees see the changes based on their input, which are being implemented, and consequently, they feel more pride and ownership in delivering that successful customer experience, and that drives them to deliver a better customer experience going forward. So really giving them these tools to say, we listened to you, we unburdened your employee journey so that you can focus on consumers, we gave you the right tools, and we involved you in the process to not only understand our consumers, but also understand what you're spending time on and empowered you to really deliver that better customer experience. And another element, sorry, Patrick, were you going to add something there? Okay.
No, that's great.
Got it. Another element which really maximizes that investment in CX is the culture evolution and making sure that you're creating that momentum and pride that is associated with delivering great consumer experiences. So on the left of the page, you'll see this box, and this is consumer experience traits from our research in the red color that we see great customer experience focused organizations do. So for example, they're more autonomous or equal versus hierarchical, more improvisational. But often in our work with healthcare systems, we see that they're more focused on the left. So they tend to be, for example, more risk averse because traditionally they've been focusing on safety, quality, and kind of that's how we've been brought up in the healthcare industry. But as we innovate for better consumer experiences, delivering more direct-to-consumer products, it is really being comfortable with that risk. So moving towards these right-hand side traits, and how do you actually get there is using some of the steps that you see on the right-hand side of the page. So understanding your culture is the first step, because culture is really difficult to change. So we suggest that you understand your culture and work within your cultural situation and really use the elements that energize your organization. Really pinpoint some of the critical behaviors, starting from perhaps some of the traits that we talked about and say, these are the 3 to 5 critical behaviors that we all need to do as leaders, as employees, to get to that enhanced CX and deliver those critical behaviors using both your informal organization, so your informal leaders, kind of people that everyone goes to for advice and activating that network very intentionally, as well as formal leaders, right? So your top-down communications, training, change plans, as well as how your compensation and incentives are organized around really incentivizing and measuring success around CX.
So this sounds like it could be a lot of work, really digesting all of that data, but we're here to tell you that there's a lot of technology that can be leveraged across this effort. So you can leverage a lot of technology to, well, collect feedback from our consumers. We can listen to them, and we can not only understand what they're giving us in terms of structured feedback, but unstructured data too. We can look at that and really gain some pithy insights about the consumer experience and opportunities to improve that. We can deploy a broad set of survey solutions. Also, today you can have artificial intelligence or machine learning take a look at those interactions and determine really which ones are maybe most problematic for you. But it's not just about collecting the data. We need to create insights around that. And there's technology and platforms that allow us to pull all of that data together and ultimately create dashboards that help us track how we're progressing on improving the consumer and employee experience, or improving our return on experience. The insights won't mean much unless we can ultimately take that into actions in the organization. And again, there's marketing technology solutions out there, there's CRM tools, and we can create alerts and nudges that begin to move the behavior of the organization. So what we've seen when we've deployed this in organizations is that while it can feel like it's a lot of information to digest, there are leading technology solutions out there that we've worked a lot with that will get us very quickly to creating insights and ultimately taking those insights into action in your organization. But let's spend a moment before we wrap this up together to focus in on what you could do tomorrow to get started on this. And this will, you'll see that it begins to pull together the conversation that we've had with you today. So we can start by taking a new and fresh look at our voice of the consumer and what we are doing to listen to our consumers. Is it broad enough? Does it capture enough of the journey? And does it go beyond the traditional HCAHPS and NPS scores that we traditionally look at? So that's step one. Take a look at it with a new lens now that you're seeing it with fresh eyes from the conversation from today. Two, we can hone in on specific transactional moments that matter for our consumers. And it's not just about getting consumer feedback after the whole journey is done, but you can start to collect insights throughout that journey, right? And getting to those important transactional moments. Is it easy to book the appointment with your physician? Did you have a good experience while you were in the hospital? Was the checkout and the instructions heading home relevant to you? Did the billing questions that you had get resolved and satisfied quickly? Some examples that you can use across that consumer journey. And as Inshita talked about, it's very important that we tie in the employee feedback, but it's not just about feedback. Why not tomorrow begin training frontline employees on consumer experience interactions? They're the ones that day to day need that toolkit to have more meaningful interactions with the patients and consumers that they serve. And then finally, you can listen a little more intently to the employees within your organization, the care teams that are serving your patients, by deploying a quick survey, not one for every interaction. You don't want to overburden them. We've talked about that already. Just on occasion, say maybe every 5th survey could go to a nurse or a physician assistant for their feedback on the interaction, their engagement with the consumers. Let's listen to our employees and understand what they're dealing with. Adam, that takes us through today's return on experience presentation. I'm sure there's questions, so back to you.
Yeah, I've got lots of questions to share. Thank you so much to the strategy and team, Patrick, Matt, Inshita, for that's such a great presentation. I'm thrilled to share some questions. Audience, please feel free to send questions in. We'll get to as many as we have time for. And if we don't get to your question, we'll be taking them in and running them by the team here to make sure that we're getting you some good answers. But I want to start with Inshita. I want to start by asking you, we think of I think sometimes in the industry, experience is thought of as as a nice to have too often, or something that's like simply a product of other processes, right? Experience just happens. And I think we all here would argue that shouldn't be the case. So I want to understand, what is the value of focusing on experience and investing in the people, processes, and technologies that make it better?
Yeah, I'll take a first stab at that. I think coming from especially a hospitality background, there is a lot of value and experience that I see, especially in healthcare organizations, and that focus. I think overall, as we talked about, there's a lot of both tangible as well as, I think, intangible benefits of investing in experience. So aspects that we can quantify, and sometimes we zoom in too much on, are just that increased revenue, better brand recognition, new customer growth, right? Better employee attraction, retention, especially in this very competitive employee market as well. But really, when you have CX as that North Star and evaluate all of your organization's investments to ensure that they're really resonating with your consumers, adding that value to your consumers, there's a lot of intangible benefits that come into play as well. For example, better product and service success, more successful innovations, less time for research and development, for example, because you're constantly incorporating that consumer feedback. And on an employee side, I think just increased engagement and productivity. So those investments in experience, when done continuously and when done in this ROX way of really completing that loop of insight to action, oils that wheel of happy employees, leads to happy consumers, leads to profitability.
Amazing. Thank you so much, Inshita. I love that ROX is not just it's both CX and an employee experience, because I think at the end of the day, especially the way we look at the healthcare industry here, is you have to get them both right. So Matt, one of the things that I'm curious about, and that I think we get a lot of questions about, is when we think about employee and patient experience, especially because ROX, is both of those. Should we think about them separately, or should we be taking a more holistic approach, that includes both of them? Should we be dedicating more resources to one over the other?
They're both equally important, Adam. One phrase that I love that I won't take credit for inventing is that one without the other is a bit like one hand clapping. Right, so you need the patient experience to deliver the customer, or you need the caregiver experience to deliver the patient experience. Because unless you're Netflix, there is no customer experience without an employee experience, right? So I don't mean to pick on that company, but the idea is that unless you're a truly technology-enabled only, fully self-service, there is a frontline employee experience that's part of delivering the customer experience.
Sure.
And not only that, but the employees pride in their work, which is so critical right now, given everything everyone's gone through in healthcare, and the nurses and the PAs and the heroic efforts that they've done. That experience is so important to deliver the customer experience. But what I'd comment on is that their experience is not just an HR lens.
Right.
Don't just view it through the lens of like onboarding and recruiting and retaining people in the Great Resignation. There's actually an employee experience in how they touch a customer, and they'll be proud of that experience. And should have talked a lot about culture. They'll be proud of the experience they deliver, and that will show up in productivity and retention and other things that have business value above and beyond the CX itself. So they're truly symbiotic.
You mentioned the staff experience, and clinicians definitely have experienced significant burnout and shortages as a result of the pandemic. We also, we work a lot with non-clinical staff here at Phreesia, and you talked about the idea of unless you're a fully self-service company, that really you have to be thinking about the employee experience. And I know here, when we are pushing things to self-service like scheduling and intake, we're doing it because the front office staff or the non-clinical staff, depending on what setting you're in, have so much other work that we need to give, we're trying to get patients to do everything, that we possibly can, so that so that the information is more accurate and complete, and that employees are doing more fulfilling tasks, right? Not just sitting on the phone and taking in information and transcribing.
Absolutely. And one of the things we've seen a lot of in as companies focus on, digital transformation, is that the transformations are much more successful if the employees view the motivation of what you're doing is not just to take cost out and to reduce complexity and drive adoption of self-service for cost benefits, but it's mission driven and there's a value in what you're delivering to the patient. That actually has enormous impact in healthcare organizations which are more mission driven often, feeling that the investments in digital and customer experience are motivated to deliver value to the patient and not just remove cost.
Excellent. Thank you so much, Matt. A lot of audience members have noted that they, face or continue to face significant staffing shortages. So I'm curious how your team is thinking about the impact of these challenges on the employee experience. And Inshita, I'll start with you.
Yeah, and Patrick, Matt, feel free to jump in. But I think it's really tough for the healthcare industry right now. We're seeing kind of high rookie ratios, which we define as more that ratio between inexperienced and experienced staff. So you have, let's say, 5-to-1 inexperienced to experienced nurses now, whereas you had those coaching and mentoring opportunities available earlier. You have very high rates of burnout, of course, after the pandemic, and a lot of that still continues. And there is just constant pressure on margins, and that pressure to do more with less. So I guess some strategies that we have seen our clients implement that have worked well in the employee experience arena are really doubling down on that focus on well-being, as well as flexibility, and being very intentional about matching your incentives and compensation strategies to that. We've also seen some organizations reach out to the gig workforce or look at non-traditional channels for workforce, such as your retired workforce, or tapping people who can only work remote for positions that allow that, and giving people who can actually work in hospitals or physical locations the chance to do that, as well as doubling down on upskilling as well as training investments, both for digital aspects as well as patient or consumer focused aspects.
Excellent. Patrick, anything to add there?
Yeah, I might add that actually return on experience in some way, or at least in my mind, it's a response to the elevation of how important employee experience is in this equation. If we look back 5 years ago and you talked about being a consumer-focused organization in healthcare, you were really just looking at the consumer experience and probably solving some pain points. That's no longer sufficient. We've seen the employee experience rise in importance almost to being the #1 topic in any healthcare organization today. And what we've done is we've tried to pull those together. This is a real recognition that experience is created at the intersection of that consumer and then the caregiver that's creating that experience. We need to make sure that both of them are having a great experience. And that's why we're seeing more and more organizations look to rocks as a better solution than just some simple metrics that we've seen in the past.
Awesome. Excellent. Thank you so much. Just a couple more questions before we go. Matt, we've talked a lot about a lot of sophisticated software and kind of some big ideas here about how to track ROX. And I'm curious, some of our audience, they're smaller practices or smaller health systems, and they might not have the resources or staff to even dedicate a team member to experience, but they still want to find ways to make, measurable improvement. Is it necessary to invest in, sophisticated tools? Do you have any thoughts on how, if you are a smaller organization, how you can still kind of take this framework to heart?
Mm-hmm. There's a few things you can do regardless of the size of a company. Some of the things that we've talked about here are a shift in your mindset. So, I would say that, you can, regardless of the size of your company, you can start becoming conscious of the experience and looking for opportunities to improve it. And that doesn't have to be as analytically driven, although will enhance the results you get. So I think just shifting your mindset and the behavior in the organization, mindsets and behaviors, to focus on the patient experience and the caregiver experience will have, what you pay attention to will improve. So that's the leadership kind of leaning in there with their teams is important, regardless of the size of the company. And there are books you can get or training or things that are very inexpensive to pursue. Okay. The next thing I'd say is the technology enablers that Patrick talked about are highly scalable relative to the size of a company. So for example, and there also can be very self-service once you get set up to kind of make changes to your survey. So, companies like Qualtrics, for example, work with organizations of all sizes, so that the pricing is based on the size of the organization. So that this is something that smaller companies, and they're not the only software platform, I'm just mentioning them as an example of one that I work with a lot. But you can, you can definitely, scale your approach and take on more complexity or not based on your needs.
Excellent.
I might also add, Adam, that in some respect, the smaller organizations might actually be a little bit advantaged over the larger organizations. They tend to be more nimble. It's a heck of a lot easier to get the right people in the same conference room more quickly. You don't have to work across many organizations, and you're actually not hampered as much by the legacy, technology and physical asset investments that you've made that, you have a hard time giving up on. So I think that, as Matt pointed out, if you can sort of shift the mindset a bit, for some of these smaller, more nimble organizations, it's a lot easier to get to creating a better return on experience.
Absolutely. And Matt, you mentioned scalable software. I'll make a shameless plug that, practices that use Phreesia can also use our platform to send patient satisfaction surveys as follow-up, and it's something we encourage people to do. And it's absolutely important. You'd be surprised how many organizations aren't doing a follow-up survey.
You're not only automating the process, but you're creating a built-in way to connect X and O data.
Yeah, absolutely. So you're absolutely right, Matt. I just want to ask one more question before we go, kind of and it could be a quick answer, as we close out, but everybody loves a good prediction for the year ahead. So we're approaching the end of 2022. As we welcome a new year, I just want to understand, what should healthcare leaders be thinking about as it relates to the patient and employee experience? Are there any major changes that any of you are expecting in 2023, that you think could impact the delivery of experience and how we measure its impact? And Inshita, I'll start with you.
Yeah, I think my 2 cents, and not to approach this from a glass half empty perspective, but we're hearing a lot around ups and downs in the economy, right? And a lot of talk of another potential recession. I think I would encourage organizations to think longer term and still invest in both customer and employee experience. If anything, this is the time to build those capabilities, such as your digital tools, streamlining workflows, to really emerge stronger versus being left behind with some of the changes.
Excellent. Patrick?
I'll build on Inshita's a little bit. I think that the pressures in the economy really drive up the importance of being nimble. And so organizations that are more nimble and can move more quickly on securing consumer relationships, creating better experiences, are those that are more likely to win. And the second thing is that if the economy potentially tightens up as is expected, there's a lot more scrutiny on the investments that you're making. And are they creating the results and driving the results that you intended? And if you don't have a good solid framework around measuring and monitoring your return on experience, it begins to get very difficult to justify the investments that you need to make. So I think we're going to see a lot of emphasis on measuring the results and being able to prove that we're getting those results in the marketplace.
That's excellent. All right, Matt, your first time on a Phreesia webinar, so I'll give you the honor of having the last word.
Just to build on my esteemed colleagues' comments, investing is not only in experience, is not only something that's going to give you insights to guide the other ongoing efforts you have. So it's like every company already has initiatives they're pursuing to drive quality and better care and so forth. You want better insights to support those valuable efforts. So ROX gives you more insights than you have before, more actionable, more frequent, more actionable insights. The second thing is they drive you to get more for less from your investments. Everyone wants to get more impact from the investment they're making. And third is that it actually is self-funding. What we found is that the cost savings from cost of quality and savings on research and testing, or efficiencies of how they engage with vendors. Many companies have 5 to 10 vendors, and they can work with focus their efforts with a smaller number of vendors and get value that way. Those savings actually pay for the investments, not the vendor specifically, but the research, testing, quality, all of the above, reduced call volume, et cetera. The cost savings pay for the investment, and then the revenue benefits are 5 to 20x the investment. So why wouldn't you want to do this?
Well, I agree. That is all the time we have. I'm going to throw up just the contact information again for our lovely panelists here, as well as the team at Phreesia. But thank you so much, Matt, Patrick, and Inshita, for an engaging and informative presentation. Again, audience, if you have any questions for us here at Phreesia, I should say, if we missed your question today, please feel free to send it in before the webinar platform, before you close it, because we can get to it after the webinar. But if you have any questions for us here at Phreesia, please request a consultation using the form on the right-hand side of your screen. And thanks again for joining us, Matt, Patrick, and Inshita. Thank you so much.
And even if you just want to know what my favorite book is to read on the topic, I'm happy to answer that question.
Reach out to anybody here. Feel free. Thank you so much, everyone.
Thank you for tuning in. Really appreciate it.
Thank you.
I'm going to start